Assalamu alaikum, third years. Can you hear me? So, I'm Dr. Shafaq, and we will discuss a very important topic of surgery today. Usually, you have this topic in a ward posting because it is usually the interactive. Obviously, we have a patient, and then we will demonstrate how to counsel a surgical patients. But we can try our best to discuss these all aspects of counseling in this lecture. Okay. The objective of this lecture is every student should know what's the importance of counseling in the surgical patients, counseling in the elective surgery, and what we are counseling in patients for the emergency cases, and what is the basic concept of the counseling. If you have any question, you can drop in the chat box. Okay, the counseling actually is the communication process between the doctor and the patient, and it primarily what the purpose is to build up, establish a relationship between the doctor and the patient. In the counseling, what we do, we will exchange information necessary to assess a patient's health condition or the disease, and implement the treatment of medical or the surgical problems, and evaluate the effects of treatment on the patient's quality of the life. For the surgery, if the patient has to undergo for the surgery, the surgeon should gain the confidence of the patient by his kind approach. It's a very important. If the surgeon if the patient does not show any confidence to the surgeon, it's a very difficult for the surgeon to proceed for the surgery if the surgeon is confused or if the patient is confused both. So there should be a very kind approach, and with the very frank discussion about the problem, disease, and the benefits of the disease or the surgical procedure which has to be undergone. Pre-operative counseling by the doctors, trained staff, or the social workers. It's very important for every kind of surgery that may be the elective or maybe the emergency. What's important for the counseling is initially the counseling area. The counseling area should be a private room, a semi-private or area where there is no distractions, so the patient feel comfortable, confident, and secure by sharing his or her problems. So it helps ensure the both patient and the doctor to focus on the discussion and minimize the interruptions and distractions. Okay, the counseling skill, it's just introduction for the counseling. Then we will practically perform how to counsel the patients. The important points which should be kept in mind. Always listen the patient carefully and take the patient, give the patient time to talk or to demonstrate his illness. Demonstrate empathy. Obviously, counseling should be for maybe for the malignancy or maybe amputation, like maybe mastectomy. So always demonstrate the empathy. Do not make judgments. Understand the emotions, feelings behind the story of the person being counseled, and use the appropriate body language. No, don't show overreactions. Slides are not moving. Are they moving now? Slides are moving here. In my PC, the slides are moving. It's not moving. Still not moving. Wait a minute. स्लाइड से अभी मूव नहीं कर रही है। नुमान भाई, ये स्लाइड्स मूव नहीं कर रही है बच्चों के पास। ये देखिए वो क्या है कि जी मेरे पास हो रही है, ये सब बच्चे स्लाइड्स मूव नहीं कर रही। ऐसे तो नहीं जाएंगे पहले चैट बॉक्स वापस एक मिनट। चैट बॉक्स वापस ये देखिए अब फिर यहाँ पे प्रॉब्लम हो रही है, यहाँ से मूव कर क्लिक करें, नहीं उस पर क्लिक ना करें, चैट बॉक्स को छोड़ दें, वो तो साइड में ही रहेगा। इस पे तो हो रहा है, तो फिर इस पे ऐसे भी चल रहा है, चैट बॉक्स के बाद नहीं चल रहा है। अभी चल रहा था, मुझे पता नहीं बच्चों को क्यों नहीं लग रहा था। ठीक है, लेकिन वो बच्चों को नजर ही नहीं आ रही उस लाइन।
मैडम स्लाइड्स मूव हो रही हैं,
साइड मूव हो रही है, मगर हाँ चैट बॉक्स आ रहा है। ठीक है, ये चैट बॉक्स बार बार यहाँ से जा रहा है। ये देखिए स्लाइड मेरे पास मूव नहीं हो रही है अभी भी।
आप चैट बॉक्स बाद में चेक कर लीजिएगा।
सर मुझे कैसे पता चलेगा, बच्चे क्वेश्चंस करेंगे तो
मैं आपको बता दूंगा, मैं यहाँ से।
ठीक है, कैन यू हियर मी ऑल? नाउ स्लाइड्स आर मूविंग। Okay, we are discussing the counseling skills. I think we have discussed this, that always listen carefully to the patient and demonstrate empathy. Do not overreact by the patient's expressions, and understand the emotions, feelings behind this. Now we will discuss the steps during the counseling, how the patient has to be counseled. Initially, we have to prepare for the session, like make appointment for the patient, and then opening of the session is that just we will introduce ourselves, and then take an introduction to the patients, and then ask the patient if he needs any other person for the counseling, like if he or she is a young patient, if we have to need her parents or any guardian, he needs to be present for the counseling. So we have to ask for any attendant, and then counseling content. The important thing is starting for the counseling is to start with the initially ask the patient what he knows about his disease. Okay. Are you listening me? Okay, we will initially ask the patient that what he knows about his disease initially, and then let the patient talk. If he says that I know that I have a certain disease and start complaints starting from this and that, then let him describe his complaints, and then you will start your counseling. Like I am the surgeon who is belonging to the group who are treating your disease. I'm the part of that team which is assigned to treat your disease. Okay, and then you will start from the general things like I have examined your all reports, and I have seen your laboratory tests, and then we have assessed that you have this disease. Initially just start from very simple things, and then gradually you will tell them about the actual disease. Like if the patient came to you for the surgery of breast surgery, like she has a breast malignancy, and you have to counsel her for the mastectomy. So how will you start your counseling? Initially you will tell her that this is the disease which is curable, and fortunately you came to us in a very initial stages that it can be managed, and there is a complete cure of this disease, and we will proceed for the surgery. Then you will then show why the surgery is indicated, reason, and how the surgery will proceed. These are the points which I have mentioned in the slides. Then you describe the procedure name and its description, reason of the surgery, how the surgery will proceed. Then you will show a diagram of the surgery, that what the procedure you are going to proceed. Then after explaining the procedure, then you will tell them about the complications and the risks of surgery, expected benefits, possible adverse effects. This list is for all the counseling that is done for the elective or for the emergency. Then expected duration of the surgery. All these steps should be followed for every counseling. Components of the counseling. What is that? It's a talking based therapy by a trained person. Providing the services is extra burden, so we will get help from the staff and the health workers initially. Then they communicate all the process to the patients and attendants initially. So the counseling is not just for the surgery, it is the pre-admission counseling. The aim of pre-admission is to orient the patient and family members about the admission, like if there's a planned surgery, it is for the elective surgery. So what is the hospital protocols, facilities available in the hospital, detailed information. If you are providing the patient detailed information, it facilitates the post-operative recovery and the pain relief. Because the hospitalization is a mental stress, so we have to counsel a patient before admission. Pre-surgical counseling, it's obviously for every person surgery is a frightening event, even when the surgery is relatively minor. So the aim of pre-surgical counseling is to alleviate surgical fears and psychological preparation for the surgical intervention. So it would also help the patient for the post-op recovery. It's very important to counsel the patient pre-surgery, so make them comfortable and aware of the surgical procedure. So the post-surgical complications, the patient should be oriented on the operation theater environment. Post-operative, it usually begins immediately after surgeries and continues until the patient is discharged from the hospital. So it's just to address the post-op fears and emotional issues, to provide a supportive care for the patients. So it's a video. I'm just starting it. It will give you a basic concept of the of the counseling.
यार ये स्लाइड्स चल रही है ना, इसमें क्या हो रहा है कि चैट बॉक्स हम ऑन करते हैं ना, तो वो रुक जाती है, स्लाइड रुक जाती है। ये भी चल रही है, क्लास चल रही है, बंद हो जाएगा।
Why do I need to sign a consent form? You'll be asked to sign a written consent form for high-risk treatments like surgery. Other times you might only need to tell your health worker that you agree to what they're going to do. Your consent form is only going to be read by those involved in your healthcare and won't be shared with anyone else. Who can give consent?
चैट स्टॉप करके चैट करना पड़ेगा।
यस मैम, या तो फिर क्लास मैडम ये वाली पूरी आप क्या पहले दिखा दें, फिर उसके बाद फिर आप चेक करेंगे।
असल में मैंने इन्हीं में तो सारा कम्युनिकेशन, ये थोड़ी पूरी वीडियो सिखानी होती है, पूछना होता है बच्चों से, स्टॉप करके देख लें। अब हम चैट बॉक्स से
You'll need to give your own consent.
सही है।
ये move तो कर रहा है ना, next slide पे आ जाएगी, next slide पे move करेंगे.
फुल स्क्रीनिंग कीजिए आप.
Before you decide to have
Full
health
screen
checks or treatment, it's important you understand the meaning of informed
full screen
consent
नहीं
in
कीजिए.
healthcare.
ठीक है, ये आगे बस इसे.
Because your doctors, nurses, and other health workers will do their best to help you with your health problems. Sometimes you'll need to have tests or treatment. If your health worker wants to test or treat you, they must ask you for your consent first. Informed consent is when you clearly understand your illness or health problem and agree to what your health worker is.
Who is this? Sakina Mansur is asking that, ma'am, this detailed process is followed in civil. Not such a detailed process, but we counsel each and every patient who underwent for the surgery. Okay, whatever he or she underwent is for the elective or for the emergency. This is it's not such a detailed process which you are watching in this video, but basically what is this? First the doctor is introducing himself and then ask the patient about his complaints. Like we will start like that, I am Dr. Shafaq and मैं उस टीम का हिस्सा हूँ जो आपकी सर्जरी आपकी बीमारी को देख रहे हैं. मुझे आप ये बताइए कि आपको अपनी बीमारी से मुताबिक क्या पता है, क्योंकि यूजुअली द काउंसलिंग इज डन इन द पेशेंट्स लैंग्वेज, सो वी आर जस्ट फेसिंग हियर द पॉपुलेशन, सो we just counsel the patient in the language of the patient, so we have to make sentences like that the patient feel comfortable. So then the patient आपको ये बताती है कि भाई मुझे ये डिजीज है या मुझे ये पेन है ये वो, then you have to start your counseling like कि मैंने आपकी सारी रिपोर्ट्स का मुआयना किया है और मैंने आपकी हिस्ट्री पूरी देखी है, तो हम लोगों ने ये असेस किया है कि आपको फॉर एग्जांपल आपको जो है अपेंडिक्स का मसला है या अपेंडिसाइटिस है. फिर आपने अपेंडिक्स से रिलेटेड उसको सारी डिटेल्स बताई कि अपेंडिक्स एक आंत का एक हिस्सा होता है जिसमें सूजन आ जाती है. फिर आपने यू हैव टू एक्सप्लेन द कॉजेज ऑफ दैट इन्फ्लेमेशन, कि ये कभी कभार सिर्फ जस्ट इट्स अ हाइपरप्लेजिया और इट मे बी द ऑब्स्ट्रक्टिव लाइक द स्टोन कैन ऑब्स्ट्रक्ट दैट इज द फीकोलेट. सो यू हैव टू टेल all the details about that disease. So क्या बताएंगे आप अपेंडिक्स में, ये बताएंगे कि सूजन है दैट ये जो है दो तरीके से इसकी ट्रीटमेंट हो सकती है कि कंजर्वेटिव, जैसे कि हम दवाइयों के जरिए भी इसको सेटल डाउन कर सकते हैं, और अगर ये रिस्पॉन्स नहीं देता है या ऑब्स्ट्रक्टेड है या जैसे कि इसमें स्टोन आके ऑब्स्ट्रक्ट कर दिया जो फीकोलेट होता है यूजुअली, तो इट इज mandatory for surgery because the obstructed appendicitis is not resolved with the conservative treatment. So then patient फिर ask कि भी सर्जरी कैसे होगी, क्या होगा, ऑपरेशन में क्या होता है, बेहोशी कैसे होती है. फिर पेशेंट को आपने ओपन क्वेश्चंस के लिए बोलना है या वो खुद बोलेगी कि कैसे प्रोसीजर होगा. देन यू हैव टू एक्सप्लेन ऑल द प्रोसीजर कि इसके लिए हमें आपको प्रिपरेशन करनी पड़ेगी. प्रिपरेशन के लिए हम स्टार्ट फ्रॉम द NPO and then fluids and antibiotics, and then patient we will tell about the anesthesia, what type of anesthesia we are giving for each surgery. Like for the appendicitis, the appendectomy is done under the GA, and there are two procedures to approach, that is the open appendectomy and the laparoscopic. So you have to explain about both of the procedures and what the procedure is following in your setup. Then you will counsel about that. Like commonly we are doing here the open appendectomies in the civil hospital, and but in the private laparoscopic appendectomy is very common. So you can give the option to the patient if or she or he wants whatever he wants a procedure, he can go for that procedure. क्योंकि हम obviously हम open करेंगे तो हम इसको open के लिए counseling करेंगे. ठीक है? Any question? Are you getting me now? Slides are moving. Are you getting me all? Yes, okay. We will continue this video. This is just basically an introduction and the concept of the counseling.
Remember, you have the choice to have treatment or not. What information do I need? To help you make a decision about tests or treatment you are thinking about having, your health worker will give you some important information. You can also ask questions such as, what is my illness or health problem? What is the test or treatment? How will the test or treatment help me? Can the test or treatment cause any problems? How serious can the problems be? Are there different tests or treatments? What happens after the test or treatment? Will I get better? How long will it take to get better? What may happen if I don't get treatment?
Okay. These all questions usually the patient asks from you when they undergo every kind of surgery. As I have discussed, that you have to explain the duration of the surgery, and if the surgery is not done, then what happens? Okay, so you have to explain all the things: complications, risks, benefits, surgical risks, surgical benefits. Okay, you have to explain everything. Like for the appendectomy, if a patient asks that what happens if I don't get treatment, तो आपने उसको counsel क्या करना है? Any one of you, आप इसको क्या बताएंगे? If you don't get treatment, if you don't get appendectomy done, then what happens? What is the complication of appendicitis? Can anybody tell me? Could progress to perforation. Okay, so obstructive appendix can perforate. So what happens that a simple procedure can get complicated. Like the simple appendectomy, we will go for a gridiron incision. But if it is get perforated, so it's just like a peritonitis, and then we have to go for exploration. Like the midline incision has to be given for the perforated appendix. Okay, so what happens as there is an increase in the septic load, so there is the simple surgery can be converted into the high risk surgery. Okay, are you getting me? And these questions all you have to answer that. How long will it take to get better? Like for the appendectomy, we will counsel the patient that it's a day care procedure, or we can have a patient for a 1 day only and then discharge on the second day. Okay.
Please tell your health worker if you don't understand it, or in Australia, that your consent form is only going to be read by those involved in your healthcare and won't be shared with anyone else. Who can give consent? You'll need to give your own consent if you understand your treatment options and can tell your health worker what you want to do. You can bring your family, friends, or community members for support and ask them.
Okay, if a patient came into ER with the altered level of consciousness and he has a history of RTA, what you do? How will you get consent for that patient? The patient is Now you are. Can you hear me all? Okay. Uh, let's start again. I have started the counseling for the specific cases like appendix. I have just mentioned you that it's emergency procedure and the patients are usually young, so the counseling is very important because the parents are also anxious and the child is also have a fear of surgery. So just explain all the symptoms of the appendix, how the these symptoms are usually the patient himself told you that the pain was sudden in onset with a nausea, may have a fever, may have a constipation or diarrhea, and abdominal bloating. So you have to counsel about the all that I have explained. That initially you have to do the approaches of the appendectomy, that may be the open and the laparoscopic. So this is the diagram for the laparoscopic appendectomy. You have to mention that for the laparoscopic surgery, you have there is no incision, just there the port side marks for the incisions, and then we will just do appendectomy and then closes this holes. These are port side. Two ports or three ports are used for the laparoscopic appendectomy. Okay, any question? You have to told the patient about the complication of the surgery. In this, you mention the complications regarding the anesthesia complications, surgical complications. In the surgical complication, you have to explain the intraoperative complications, post-op complications. So, like you must have appropriate knowledge of the disease, so you can counsel the patient. Otherwise, if you don't know how the surgery can be proceeded and what are the complications of the surgery and how the complications can be managed after the complication has been done. So these are all important to gain a confidence of the patient, because if you are explaining him that the patient may have a wound infection after the appendectomy, so the patient can can refuse for the surgery, that the surgeon is not confident that the patient wound can get infected. So you have to explain the ratio that every patient does not having all complications. This is the certain ratio in the patient get having the complication, and these complications can be managed easily by admitting the patient in the ward and then with the daily dressings and the antibiotics. So you must have to explain each and every things very clearly to the patient, that even until the patient will discharge, the doctors or the surgical team will take care of the patient. So the patient feel comfortable and give you consent for the surgery. Any question? So this is another video I just show for 2 minutes. That is how the surgery in the simplest.
Informed consent in a patient's shoes. Uninformed consent goes something like this. Okay, Mr. Miller, we've had your blood test back. Your white cells and CRP are up, so we do think it's appendicitis. What we can do for today is take you through oral operations, take your appendix out, and get you better. Okay. Fairly low risk operation, just a few cuts in the tummy. There's a risk of pain, bleeding, and infection, and there's a risk that you might need to make that bigger operation. I've signed here. Just sign here for your operation today. Okay, and we'll get you up to this, get that done today. See you later.
Okay. What was this? Is this informed consent? What she did? Is this a proper counseling for the surgery? What she did, she just tell the patient that he has appendicitis and he has to undergo further surgery. And what happened in the surgery? There will be a pain, bleeding, and etc. And then you will discharge after 1 day. And then she has taken the consent paper signed. Is this informed consent? Look over the patient's expressions.
What's the other thing? What is it? What is chemotherapy? What about it? Valid patient consent requires information and understanding. Not all patients feel empowered enough to ask doctors questions or to let us know when they don't understand. Hello there, Mr. Miller. I'm Ellen Jerome. I'm one of the surgeons working with Mr. Phil on the consultant call today. Hello, Doctor. Hello. We've had the results from your blood test back. Some of the markers of infection are raised, which supports the diagnosis of appendicitis. That is a operation on laparoscopic appendicitis. Do you know anything about the appendix or appendicitis?
Look, she has asked the patient what he knows about his disease, and now she is going to explain what the surgery has, how the surgery would be.
How to assist your body, your legs, just a few minutes of explaining to the patient what's happening can make all the difference. Okay, then, Mr. Miller, so just to summarise, we talked about appendicitis and why we recommend moving the appendix to treat it. We've talked about what your recovery is likely to be, and a bit about how we do the operation. Do you have any other questions at the moment?
No, I feel very well informed. Thank you very much.
I've written out a consent copy, so just sign on the line.
See, in the last, what she did, she asked any question, he wants more. So it's a very important thing. The patient feel comfortable that she has explained each and everything and asked for the further any query for the procedure or for the surgical risk. So this is the proper informed consent. So this was the emergency. Now, for the specific elective counseling, many procedures we used to do here, like the cholecystectomy, mastectomy, hernioplasty. Anyone of you now can raise hand so that we will start practically how you are understanding how to counsel the patient. What happens in the cholecystitis patient with the stones? They are symptomatic, so the gallbladder has to be removed. It's done by the open or laparoscopic method. So anyone can volunteer, can be start counseling. Can raise hand. So we will start counseling. Anyone can voluntarily show interest counseling the patient for the cholecystectomy. Raise your hands. अनम्यूट करें, देखिए कोई बोलना चाह रहे हैं, मुझे पता नहीं चल रहा है। रेस हैंड नहीं कर रहे थे,
कुछ हो ही नहीं कर रहा
है ना, खुद से नहीं कर रहे ना, इसका मतलब
जी कोई भी शो ही नहीं कर रहा। जो करेंगे सब सुपर आ जाएंगे।
बैग में इसलिए खोला मुझे
यहाँ पे सब अलाउ किया हुआ है, जो भी करेंगे सामने ले लेंगे।
No one it means that you don't understand how to counsel a patient. Anyone can start counseling with me. I will be the patient and you will be the doctor. Start counseling. Anyone raise his hand? We will do counseling here. No one is willing. Okay, what we do in the counseling for the cholecystectomy starts from the procedure is same, steps are same. Introduce yourself that I'm anyone can voluntarily अगर आप लोग साथ में करें तो आप लोगों को बहुत easy हो जाएगा फिर ये understand करना कि how to counsel a patient. क्योंकि आप लोग सिर्फ देखे जाने सुनने जाने काउंसलिंग इज नॉट लाइक ये स्लाइड्स पे आपको सीखने वाली चीज नहीं है. यू हैव टू डू इट. इट्स अ प्रैक्टिकल थिंग. This process is same. Introduce yourself, ask the patient his name, and then ask the patient how he needs any attendant with him. Then you start from how he knows about his disease, and then you start to explain what is the cholecystitis, what's the indication of cholecystectomy, whether every patient with the gallstones has to undergo surgery or not. And if the patient does not go under surgery, what happens? What are the complications of the procedure? What approaches? And then you have to tell them the benefits of the laparoscopic surgery over the open surgery. Then you have to tell them about the complications of the surgery, laparoscopic complications, and the complications of the open surgery. What is the most common complication of the laparoscopic surgery? Laparoscopic cholecystectomy. Anyone can tell me? What happens? How the lap choles perform? Okay, just tell me the benefits of the laparoscopic cholecystectomy over the open cholecystectomy. How would you counsel the patient for the lap compared to open? Tell me. Just drop your message in chat box. Indications, benefits of the laparoscopic surgery over the open surgery. What are the advantages? If a patient came to you and he insists for the open cholecystectomy, how would you counsel him for the lap chole? Okay, शुक्र है किसी एक ने तो response दिया. Is small incision less chance of infection? Or yes, good. Duration of the time हो गया, infection का risk हो गया, incision हो गया, wound ठीक है. Is there any pain? Quick healing ठीक है, that is just same thing. Shorter recovery of the time and less pain because the less size of incisions. ठीक है, in the open there is this large incision, and for the laparoscopic just 1 centimeter incision has to be given, so less chances of infection and less pain. Yes, pain is lesser. Okay. And shorter recovery means that shorter time admission. Laparoscopic surgery is a daycare surgery, while for the open surgery we have to keep the patient for at least 2 or 3 days for the wound management, for the assessment of the wound. So these all things has to be explained for the laparoscopic cholecystectomy or for the counseling in the cholecystectomy. Then what the complications you will tell the patients. What happens in the laparoscopic surgery? What the more complications have a risk in the laparoscopic surgery? It means that what the disadvantages of the laparoscopic cholecystectomy over the open? Yes, it's more expensive. It needs expertise, and there is a hand-eye coordination. So there is no tactile sensation. So what happens? If the surgeon is not expert, there may be the iatrogenic injury. There is a more chances of iatrogenic injury. Hemorrhage can occur in both type of surgery, the open or as well as in the lab. But in the lab, what happens if there is a hemorrhage? The surgery has to be converted into the open, because it's very difficult if there's a major hemorrhage occurs during the laparoscopic cholecystectomy. So these are all things has to be explained. What injury, iatrogenic injury, is most common in the laparoscopic surgery? What structures we used to clip in the laparoscopic cholecystectomy? Yes, bile duct injuries. That's good. Who is this? Hadika Talha. So bile duct injuries are common in the laparoscopic cholecystectomy. And it's done usually by clipping the cystic duct. Okay, for the counseling, start from the pre-op. You have to counsel about the NPO, the procedure type. We have discussed post-op complications, and then post-operative. You have to counsel the patient about the eating habits, because you have removed the gallbladder. So what should be the diet now the patient should follow, and then the wound care. All these points have to be told to the patients. This is the laparoscopic surgery. You have to draw a diagram to show how the surgery has to be performed. कहाँ ports डालेंगे, ports की position, and then how the pneumoperitoneum is created. And so you have to assess the patient's pre-op for the general status also, like the patient if he has any respiratory illness or diabetic or everything. So you because the laparoscopic surgery has to be underwent under the GA, so patients has to be fit for overall. We will get the fitness, cardiac fitness, and then general anesthesia fitness before the surgery. Any question? Any question? Any question? Yes, we have discussed. We counseling about the general anesthesia. Yes, because yes, it's important. Usually, we send the patient for the GA fitness. So the anesthetist usually counsel about their domain themselves. Okay, they counsel the patient about general anesthesia, the drugs used for the anesthesia, what are the possible side effects of these drugs. This is all done with the anesthesia team in the theater also, and there is a pre-op fitness session or counseling session for the anesthesia. Yes, laparoscopic is more expensive because the instruments are expensive. Any question? This is just like if you know the disease properly, you can counsel, you can answer these all questions, that what extent should we push a patient for a procedure that we think it's safer. What do you think that if the patient have a symptomatic gallstone, means like she has a biliary every 15 days. She has to be admitted in the emergency department for the IV antibiotics and then fluids. And then she had an episode of pancreatitis secondary to gallstone. What do you think that the cholecystectomy is not beneficial or safer for her? It is. So you have to counsel the risk procedures. Like if the patient having no comorbidities, it's very simple daycare surgery. Laparoscopic cholecystectomy is considered as a daycare surgery. So it's a very a safer procedure for the symptomatic gallstone, not every cholelithiasis. Okay, it's just for the symptomatic cholelithiasis. And what happens when you skip the treatment completely? What you should think of it. What happens if there is a gallstone? What are the complications of the gallstone? They can obstruct the CBD, and the patient having the obstructive jaundice. It may get infected and having the empyema of the gallbladder, mucocele initially, and then empyema, obstructive jaundice. And it can causes the gallstone pancreatitis. So these complications are more high risk or more prone to sepsis. So it's very safer to get cholecystectomy done before all these complications happen. Explain. Any more question? Any more question? I think it's enough for today. You must do practice and you must watch the videos more.